Addressing knee stiffness after surgery can be quite uncomfortable. If you've had your knee replacement surgery and you're not getting full extension and flexion, I'll take you through a few exercises that you can do at home and ways that you can improve that flexibility, okay? The first exercise that we'll do is walking. It's the simplest exercise that you can do, and it's one of the best ways of just preparing your body for the stretching that you're about to do. Jumping right into the stretching can be quite uncomfortable, so if we start with a walking activity or just any exercise that gets the blood flowing, that typically helps out. So we'll go out for a walk and we'll kind of discuss some ways that walking can help, and then we'll go through the series of exercises. Go ahead and follow the exercises in these order, or you can go whichever way helps you the most. Let's go outside. Now, walking is one of the best exercises that you can start with. I say start with this because jumping right into stretching out the leg can be quite uncomfortable. So one of the ways that walking helps out is it warms the body up and prepares it for movement. So when you go ahead and stretch, it makes it a little bit more comfortable for you. So when you're walking, you're increasing circulation to that area. Also remember we talked about edema in the legs, so that swelling that occurs. Once you get moving, some of that edema can be flushed out of the legs, making it less stiff. Now another benefit of walking is after your surgery, you're not walking like you normally did before. So by just getting more repetitions and practicing, you're able to get back to walking normal. Now with walking, the goal is to just start small and build up. Start by walking 5 minutes and do it throughout the day. Now if you can tolerate it, go up to about 10 minutes. You want to be able to sustain this for a little bit of time. So try to get that 5 minutes at least, and then you can get back to the stretching. Some ways of making walking a little bit better and more enjoyable is to get a partner. Get a partner that you can walk with. It makes it more enjoyable. Takes your mind off the pain. Another thing you can do is just watch out for where you're walking. Walk in a place that you're familiar with, close to home. Don't walk out too far. Remember, it's a two-way trip. Where you go, you have to come back. So if you walk too far, you might get stuck. So walk where you know you're able to walk back home from. Also, you want to just make sure you're using the proper equipment. If you were given a cane, walker, whatever you were given, make sure you're using that to give you a little bit more support so it can help you out. Another thing you want to make sure you're doing when you're walking, just make sure you're wearing comfortable clothes, clothes that you're able to move in and free you up. You don't want your clothes to be too tight, and wear some comfortable shoes as well, just to protect yourself. Okay. All right, let's get to stretching. First exercise is a seated heel slide. You're just moving the knee, bending it as far back as you can, and you should feel that stretch in your leg. Once you get comfortable, bend it back some more. Now you can use your other leg to help you out and bend that knee back some more, just so you can get a little bit of extra flexion. This will help you bend the knee better. Now with this, you can also lean over that leg and press down into it. That should give you a little bit of an extra stretch. Do this to your comfort level. Now to get the knee straight, we'll just go back and forth, sliding your leg down. It's important that you use the top muscle, really squeeze that muscle as you go down. This helps the back of the muscles relax right there. You should feel the stretch, and if it feels too uncomfortable, just press your toes down. That should make it a little bit more comfortable for you. The next one is to work on just getting that knee straighter. You should feel that stretch in the front and the back of your leg, and you're just pressing it back and down. As you can see, I'm moving my ankle back and forth to also help make this more comfortable. I keep my back straight also, and I just keep working that. Now the next one is a knee drive. Just get a chair that you're comfortable on and just rock back and forth, bending the knee. This is similar to the first exercise we did with the seated heel slides. This one is a little bit more aggressive. As you can see, I'm bending the knee a lot further. You'll also get a stretch in the back of the leg in your calf area. That's quite normal. Just rock back and forth. If you get to a comfortable spot, you can just hold it there. This is just another angle, and if you notice you have increased tightness maybe on one side, you can just push your knee out that way. You can also grab onto a chair to help with support. This is a stretch, not a balance exercise. The next one is a self-tibial glide. This exercise is one where your physical therapist would typically move your knee joint to help it move better. Now, what you do is bend your knee as far back as you can and then come out of it a little bit. Then you move your ankle up and down. You should feel a stretch in the front of the knee, and that's just helping that knee joint move better. Bend your knee as far back as you can tolerate and go back and forth. Next one is similar to what we did with the seated terminal knee extensions. This time you're laying down. Now this is a nice exercise to do because you can really get a lot more strength through the front of the legs. You're pressing your toes down and you're lifting your knee up. Be careful with this exercise. A lot of people will compensate by lifting the hips up. You just want to check that and make sure your hips are pressed down. Go up, squeeze that muscle, and repeat. After you've done all this, your legs might be pretty sore. Icing typically helps, but that's up to you. But definitely do elevate your legs above your heart level. Put some pillows underneath. Move your ankles up and down, and that should help with the swelling. Kick back, relax, do this for about 10 to 20 minutes. Watch the TV, and you're good.